Hi, it's Dr. Herman here. I'm sitting here with Lisette Colon. Lisette is one of my patients. She came in diagnosed. She found me because of a neuropathy advertisement I have on the internet, but she has a diagnosis called chronic inflammatory demyelinating polyneuropathy. That was the diagnosis that the doctors gave her. She's been going through treatment right now for 2 weeks with me. Today is day 1 of week number 3. And Lisette had some exciting news to share with me today. But first, before we get to the exciting news, let's just discuss a little bit about, first of all, at 40 years, how long has this condition been, how long have you been suffering from this?
It's been a year.
A year.
A year.
And who first diagnosed you with this? Not who, but what type of doctor was it?
A neurologist.
A neurologist. Since you've been diagnosed, how many hospitals and doctors have you seen to try to figure this thing out?
I have been just to one hospital, but I have seen 3 specialists.
3 specialists. Is that the Jacksonville Hospital?
Jacksonville and UM.
Okay. So University of Miami and Jacksonville, which is northern Florida, and 3 specialists.
3 specialists.
What were their titles?
They were
all neurologists?
Neurologists.
All neurologists. And all that they've really done for you, and correct me if I'm wrong, but they gave you some medication.
Correct.
And that was it, just gabapentin?
Gabapentin.
And that's an anti-epileptic seizure medication called gabapentin. And so your condition was all your symptoms from head to toe?
Head to toe would be numbness, tingling, extreme pain when I'm in my worst condition.
Numbness, tingling in the hands and feet?
Correct.
All over the body or just hands and feet?
Hands and feet.
Hands and feet.
And just pain, pretty much a lot of pain in my feet anytime for walking.
Okay. And when she first came in, the walking was it was like a loss of control of the feet. To lift up the foot and put it down, it was like, can I call it a duck? Like plopping. We call it plopping. The feet were just not really, she wasn't able to control the normal, there was no normal gait pattern. And right now, so you can tell the crowd what's been going on.
Right now, I have gone from 1,800 milligrams of the gabapentin down to 900 milligrams and not experiencing any pain. I have minimal numbness, which is such a plus, and I'm walking, I would say, normal.
You're walking normal. And your feet, you just told me over the weekend, you were able to, the rigidity and the numbness.
The rigidity of my toes are so rigid that I would have to manipulate them. But this morning, it was very easy, and I was able to actually feel my husband's hands on my feet, which I haven't had for over a year.
Didn't you tell me at certain points, that's great, didn't you tell me at certain points that your hands, you felt like your hands and toes were curling in?
Yes, and when I would have, when I have a flare-up, what they call a flare-up, that's what would happen. They would curl in, and they would just kind of contract and stay in that position for a while.
And even more painful.
Extreme pain.
Extreme pain. And today she has feeling in her feet. There's no pain in the hands or left. No pain.
I have no pain.
No pain in the hands. No pain in the feet. You have feeling back in the feet. You're walking normal. And this is just the beginning of week 3. And what we've done so far is the exercise with oxygen therapy. She's on nebulized glutathione, a very strong antioxidant, the strongest of all antioxidants. She's on here daily. We're doing brain-based stimulation with our interactive metronome. We're doing balance, coordination strategies, techniques in the back of the office on a balance board, and different stimulation on the feet, and like magic. Yes. It's all coming back.
It's all coming
and we're not done yet.
Not done yet.
Okay, but she just started a very strict elimination diet as well. So there's going to be more to come, and we'll be back in touch. But I appreciate you taking the time.
Thank you.
Okay.